My name is Lucy Sanctuary. I am a speech and language therapist. I am a cognitive behavioural therapist. I do adapted CBT, very adapted, and I only work with neurodivergent people and have a family-focused approach in my therapy. I do diagnostics and I am an ADOS 2 trainer. So we're going to have a little think about what is ADOS 2 training, and then the requirements that you need to do the course and that you need to be able to use the ADOS 2 in autism assessments. These are really important. And I go on about this quite a lot, but I think it's such a different assessment to learn than other assessments. And you have to work so much afterwards and you need support afterwards. And that is very different to a lot of assessments. So I think it's really hard for people to understand what I'm saying often until they've done the course or they're on the course. And I really just want everybody to have all the information that they need to inform their decision making. And then I'm just going to tell you a little bit about the course that I do and who it is appropriate for. I think the thing is that there's a range, different courses appropriate for different people, and I want to help you to be able to choose what is right for you. And none of our courses are right for everybody. So, it's just really being transparent about this. So, what is involved in autism assessment? Well, the ADOS is one part of the autism assessment. And I don't know why, but often it's thought of as being kind of standalone, diagnostic in its own right, or that it is the autism assessment. No to all of those things. So, there are different parts that are involved in the autism assessment, and the ADOS becomes diagnostic when it's put together with those. So autism assessment is based on a diagnostic criteria, and we either use the DSM-5, that's the version we're at now, which is the American diagnostic criteria, or the ICD, we're on version 11 at the moment, which is the European version. They're very similar, so it doesn't matter which one that you use. So you have the developmental history, which is looking for features in the past, which is part of the criteria that there has to be evidence from a young age as well as now, and that there has to be impact and that it can't be better explained by something else. We have the direct observational assessment, which is the ADOS, which is happening live and now in the present. And then also we get information from school, early years, university, work, whatever is appropriate for that person. In fact, I'm just going to go to a little picture of this. It's easier. Here we go. So this is all the parts of autism assessment. There aren't any medical markers that we can use to identify whether someone is or isn't autistic. So we can't kind of do a scan and go, oh, look, there it is in their big toe. So we have to have as much information as we can. And people are different in different situations. We know that. And we know that even more now since we know about camouflaging. So we have the history part, as I said. We have the part now, which is it's not always the ADOS either. The ADOS isn't the correct tool to be used with everybody, and the authors are completely open about that, and it's not standardized for use with all groups of people. So, and then we have additional information which we get from school, from work, from other professionals. I mean, I've sometimes assessed people where they're not in school, and then I've got it from scoutmasters, from forest school, from other sources. But you just want to be able to have as wide a picture of someone as you possibly can. And then we also think about differential diagnosis. So we want to be sure that what we are seeing is best explained by autism rather than something else. And then we put all of that together, thinking about the criteria to help us come to a diagnostic conclusion. And there are different people that are involved in autism assessment, so not everybody can give the diagnosis. So I'm a speech and language therapist, I cannot. The professions that can give a diagnosis are ones who are trained in differential diagnosis. So that is a paediatrician, a psychiatrist, a specialty doctor, a clinical psychologist. I think that might be it. So for people like me, we have to always work alongside those professions. But it's great to work in a team anyway. This is a picture of the ADOS. So it's very, very big and very, very expensive kit. It's got all the resources that you need for any age in it. And this is how the ADOS is described. It's a semi-structured, standardized, observational, evidence-based assessment. And these are the conditions that it's standardized by. Okay, so it's standardized by the materials. So we all use the same materials, by the training. So, regardless of what training you do, all trainers train you in the core information that you need to be trained in. We're all trained to use the ADOS in the same way, to use the same time frame, to administer the tasks in the same way, to use the same prompts, to give the same instructions. That makes it sound as if you're like a robot. No, you're not a robot. So there are these standardized conditions that you follow, but everybody has their own style, and you can be your own person. We are looking for the same things. Our training teaches us to look for the same things and then to interpret those in the same way and to code in the same way. That's very complicated, all those things. And actually, those are things which we need to work on continually. So even once you've done the training, we carry on doing something called reliability workshops, which is where we watch a video, we all code that video, and then we just make sure we're all coding in the same way. We're all noticing the same things. We're all interpreting those in the same way. Okay, I think this word introduction is another really, really important word. The training is not the end and the be all. It really isn't. It is an introduction. And I just can't stress that enough. I mean, the other thing as well is that it's not actually just about the ADOS. So you do have to know the ADOS inside out. The thing is that the ADOS is a lens that you're looking through, but every single person you see is different. You don't see the same things twice. Everybody is different. So it's also learning to be able to look through that lens at an enormous range of different people. And then that also means you have to have a very good understanding and knowledge of autism because you're going to see so many different presentations. We assess across the lifespan and we have different what are called modules. And the trainers introduce you to these modules and explain to you how you choose which one. And they also teach you about the coding that we use, what the conventions of that coding are, and what the descriptors mean, and applying those to the evidence that you get from assessments. So what we do is we try to teach you everything that you need to know about the ADOS, and we show you all the complexities, but then you have to work at that afterwards. And I think that is, I mean, for me, like I've done this for a long time and I'm still learning. And I actually find that really exciting and really incredible and really amazing. Okay, so when the ADOS was first introduced, it was introduced as a research tool. And at that time, it was used with a very specific group of people who all specialized in autism and were really knowledgeable and really experienced. And the training was just so related to what they were doing and what they'd observed. And that's very different to now because of the pressures of the waiting list. And, we're doing so many more assessments. It's opened up a lot, which is a good thing as long as people have the right experience and knowledge to be able to do this. So then, obviously, when people heard about the ADOS and that it was being used to do assessments for research, they wanted to do it clinically because it makes sense, doesn't it? I mean, there hadn't been a standardized assessment before that. So people were using all sorts of different things, and then they didn't have a common framework to build on their findings or to come to kind of common conclusions or to even be able to discuss findings from research. And yeah, so it changed a lot having this and also changed a lot clinically too. So, the ADOS is evolving all the time as well. The ADOS 3 will be coming out. I don't know exactly when, but it's being done at the moment. And this is in response to our growing knowledge about autism, about assessment. So this is an ongoing thing. So when the ADOS was first introduced, the training was 2 days. So at that time, like 2 days was exactly right for the skill level and the knowledge level that everyone had. But like I also said, the landscape has changed now. It's still 2 days is great, fantastic for a lot of people still. But maybe for some people, 2 days isn't quite right for them because maybe they don't have that very specialized knowledge and background in autism and working with autistic people and assessing autistic people. This is the course requirements on the website for the University of California, San Francisco, where Summer Bishop is a trainer. And she's one of the co-authors of the ADOS, and she's absolutely fantastic and such a lovely person. So on the website, it says, the introductory training is intended for professionals involved in assessment of autism spectrum disorder who are interested in learning more about how the ADOS2 can be appropriately incorporated into a diagnostic assessment battery. That's the picture that I showed you earlier. And these are the prerequisites. I can never say that word. The workshop presumes that trainees will have prior training in and experience with diagnostic assessment of neurodevelopmental disorders, including autism. I think we don't think about that as much as maybe we need to. You have to think about which course is going to suit your level of knowledge and your experience. Information on the website also says, following the workshop, additional practice with administration and scoring will be necessary to ensure competency in using the ADOS2 for clinical or research purposes. Yes, this is what I've been saying about support. You cannot just go out and do it. You really can't. We have to all be reliable in our coding. And what that means is that we have to be 80% at least in agreement of our coding with trainers who are coding assessments that we are watching. So there's something called reliability workshops, which is very similar to the things you do in the training, where you watch a video, you code it, and you compare your coding to the coding done by trainers. And nobody gets to that kind of level immediately. We have to work at it, and we have to keep working at it because it's very easy to drift away from those standardized conditions. So when you are deciding what course you're going to do, it's really important that you think about your knowledge and experience of autism and that you match that to what you're going to do. And also that you are able to see, maybe I'm not at that stage yet. Maybe I need to go away and get more experience so that I can eventually go on to do the training. I think it's really important that your expectations are accurate and realistic for you more than for anybody. You have to think about your learning style. I mean, some people learn this very fast, and that is also because of their level of experience. So they can do a 2-day training and take all that in and respond to that pretty easily because of the level they're at and because of the way that they learn. But not everybody learns like that. Some people need more time to be able to process the information. And if that's you, you can do a longer course. And then, I keep going on about this, but you have to really think about support that you have in place. It really is much harder. I can't stress this enough. I think I probably am stressing it like enough. I hope I am. And I just hope that people will take that seriously, that you do really need help. There are really long waiting lists. We know that. The NHS is now using Right to Choose to help get through the waiting lists. But, at the moment, money is so difficult. We're not quite sure what's going to happen with these contracts and whether they can continue like this. So I think there's a kind of idea that people can train and go straight into Right to Choose contracts, but it is not always quite like that. And people do want experience. So there are roles where people take on newly qualified ADOS2 clinicians, but it's competitive. You just need to really think about all of these things. Here is a quote from the manual. Even a sufficient educational background and experience with autism, simple attendance at a workshop is not sufficient to ensure competent use of the ADOS. So I run really small ADOS trainings and I'm thinking about making them even smaller. Why do I do that? I do that really because I really like to make them bespoke and to give as much help as I can to people. So like everybody, I teach the core, but then I add to that. So I started off doing the 2-day training, but I just realized that for so many people, they needed more than that. So then I made it 3 days, but I realized people still needed more than that. So I made it 4 days. The thing is that even 4 days is intense because there is so much to learn. But with 4 days, I feel like I can focus on parts that people are struggling with more. I can add lots of different things depending on what people are struggling with. I can spend more time on focusing on parts which are harder for participants and that they want to spend more time on. I can put in more discussion parts, I can make it more collaborative. And when I do it face to face, I can put in administration. And actually, when I do it remotely, I always put in like problem solving things and try to do things which are related to administration as much as I can, although obviously you're limited when you're doing it remotely. I really want to help people to do a very good job. I want to give them as much as I can before they go out there and start putting that into practice. So, like all training, we have input on the mechanics of the ADOS, what it is, and watching videos and coding, but I do a lot of work on areas that are tricky as well. So, pulling those out and focusing on those. And I try to make it as collaborative as I can. So I use breakout groups for discussion and for different tasks and things. I really also, I don't know, it means a lot to me. I'm neurodivergent myself, all my family are. We've all been through assessment processes, and yeah, it's more than just a job for me. And so that kind of comes into my training as well. I like to work with people who are really committed to developing those skills and doing the very best that they can. And I suppose have a similar kind of ethos to myself. Yeah. Yeah. It's an intense experience. It really is. It's a wonderful experience. And, whatever training course you do, you learn really a lot. I mean, it's just really about finding the one that is right for you. I don't take everyone on my course. I'm sure probably all trainers will say that. I want people to have the right amount of experience. I want them to have the right amount of support. I am very, very honest about this. Probably that seems very blunt to people, but it is not for my benefit that I'm being, well, it sort of is for my benefit, but it's not just my benefit, is it? It's for everybody else's benefit. And it's actually for the benefit of the people that we're assessing as well. I'm just honest about like what you need to be able to do the ADOS, what's involved in that, and also what it's like afterwards. I know a lot of people that trained and haven't been able to get work. I don't want anyone to waste their money. So, yeah. So I do give quite a few pre-course tasks, but you don't have to do them. So the normal reading, I think everybody gives that, and you have the chance to watch an ADOS as well if you haven't done that. So you're kind of a bit prepared beforehand. I use, yeah, as I said, discussion work, group work, lots of different resources which I give to everybody. I give anonymized ADOS 2 reports. I give instructions for tasks for people to keep. I always give detailed evidence of the consensus for the coding that we've done, and people can watch the videos for up to 3 months after the course. And then there is post-course coding that people do for the certificate as well. And then afterwards, we always meet maybe like 3, 4 months after the training. We meet up to catch up on what people are doing, to answer any questions. It's like a kind of catch up supervision session. But I am always happy for my trainees to message me, to ask me questions. I always try to help them if I can, put them in touch with other people. And yeah, yeah. So I hope that has given you an idea of what the ADOS training is, what you need to know in order to be able to do that, what you need to do yourself after you've done the training, what the difference is between the different trainings that are out there. And I just hope it helps you to think about where you're at, what is right for you, and what is out there. But I really do recommend researching all the different courses. And also, I really recommend researching work that is out there so that you know exactly what the situation is. Okay. So, yeah, as I said, I hope that is helpful and all the very best with whatever you decide to do.